Hey, Matthew Holt. You know on Sesame Street how episodes could be brought to you by a letter? Well, everybody, this episode, the July 8th episode of Health in 2.0, is brought to you by the letter P.
Is that a P or is it backwards?
No, it's a P.
I got it right.
Okay, forget the letter P. Maybe we should just be brought to you by Livongo. Did you see that stock price today? Oh my goodness.
Yeah. I did not earnings, revenue. They quoted earlier their revenues like 10 million or 15 million or something ridiculous ahead of expected. It's growing like crazy. And your friends at Teladoc also going well. I mean, so those companies are now worth, Livongo's worth 9 billion, Teladoc's worth 17 billion or something. Tesla added more than the value of Ford yesterday, and it's now worth more than Toyota. I mean, going up 50% in the last few days. It's all craziness. It reminds me of the 1800s, 1820 something it was in the UK.
Oh,
when I was a young boy and everyone was speculating on railroads, like British prime ministers were making and losing millions of pounds speculating on the railroads. They were going to be the big deal. They were going to be the future. Doesn't mean you can't lose your shirt or make a fortune on the money machine. Is that what we're talking about today, or are we talking about serious stuff in digital health?
We're talking about serious stuff. There's a whole bunch of stuff going on.
All right. I have
Ready? There's money flying everywhere. You got your 2 minutes? Hit go. Ready? Set. Go.
Go.
All right. Genome Medical extends their B and gets another 14 million on top of the 23 million they already raised.
That sounds like a lot of money. This is a kind of remote genetic counseling organization which sells both to individuals but also to people. And there is a big shortage of genetic counselors. 10 years ago, a company you've forgotten called Medco, but is being through the P, was a PBM, now part of Caremark, bought a company called DNA Direct, which was doing the same thing. So what is old is new again, and we still don't have enough genetic counselors. So there's more genomic research, so it's probably a good thing, although probably, people may get confused with 23andMe and Ancestry, but it's not like that. It's more of a, clinical operation.
Yep. All right. Other letters that we could have been sponsored by, FCC, because they've got another 198 million for the rural health program. This brings the total up to a whopping 802 million. Tell me about this. What's the impact going to be?
Well, hopefully it will be that there'll be more broadband, more access for healthcare organizations, doing telemedicine and remote care and remote monitoring in rural areas. We have a big problem in rural areas as a whole in this country. In terms of there's a lot of hidden poverty there, a lot of problems with access to healthcare services. And the idea is that this is supposed to attract some of this, new fancy technology into those areas and get people hooked up. Hope so.
All right, letter P for PBMs. Oh my God, what is going on with PBMs right now? Anthem's PBM. Who knew that Anthem had a PBM called IngenioRx buys a company called Zipdrug? Unpack this story because it just keeps exploding for me.
Okay, well, so this is about, can you get more access to people in their home? You saw Walmart bought CareZone the other day. Same kind of thing. Can you get access to medication management in the home? So yeah.
All right, speaking of Walmart, Capital RX, they decided to partner with startup PBM.
That's the end of the 2 minutes. Go on, but you got it in.
I did get it in. That's a startup PBM, Capital RX is, and they've just announced a deal with Walmart. So what's going on here?
So Capital RX is run by a guy called AJ Locarno, who was at Truveris. And Truveris was a company which is trying to do sort of data analytics of how PBMs were essentially ripping off their customers, because there's a lot of fuss about how the big PBMs have been withholding, not been transparent in their dealings with their customers in terms of their employer customers and for that matter consumers. It's a very murky business and all that money in the middle, and where does it come from, where does it go, gets lost, and how much they're charging for generics and how much they're charging for services, et cetera, et cetera. So he took the sort of basic idea from Truveris and moved it into Capital RX, which is actually doing the same kind of thing and trying to be a transparent PBM working on behalf of customers. Now, Walmart, of course, is just getting the healthcare services in a big way, is also in terms of the low price leader idea. So I think they're trying to put something together there to go to, I assume, employers and do a larger deal to try to help them figure out what's going on with their money in drugs, because as I said, no one understands PBM pricing. At least I don't, and probably most other people don't. And so the question is, can you figure out what's going on there in the middle, and can you get a better deal on drugs?
I love PBMs. It's so scandalous. It's like the black box of healthcare. I love it. If anybody wants to talk about PBMs, find me on Twitter. The other P's we didn't get to, and this is more salacious gossip than it is like a funding deal or anything like that, but Hallie Tecco and Lisa Bari were going back and forth this morning talking about some of the digital health companies that have gotten money from the PPP program. And the question that they were going back and forth on was whether or not this was like a cool thing to do, being as they were venture backed. So I'd be interested to hear your thoughts on that, Mr. Holt.
I mean, look, it's better for them to do it than Kanye West, who's worth $1.3 billion or whatever it is to take it through a sneaker company. The PPP, so I did the PPP twice, right? I did it for two little companies that I have. And the answer is that it's not clear as to whether you're allowed to do to take PPP, whether you were supposed to actually have genuinely, lost business or about to go out of business because of COVID and real trouble, or whether it was just there to keep you going as a source of funds that you could have just in case. And most people applied really right at the early onset of PPP. So how the hell do you know? Having said that, a couple of the companies, especially HealthTap, which got money, is a telemedicine company. So you assume that their business was booming during the PPP COVID crisis, and though they probably didn't during the COVID crisis. So they probably didn't need PPP as much as some others. Some of the bigger, but having said that, it all pales compared to some of the bigger organizations who got money from the government, particularly on the healthcare side, like HCA, Sutter, a number of others. So I'm not so worried about the startup venture-backed guys getting it, but one would hope that eventually there'll be some kind of reckoning. Some of them might pay it back if they didn't need the money. But most of these companies were losing money anyway, and if it kept people in some jobs when people were being laid off fast, how worried about it am I? But the most weird thing is in this whole Twitter exchange is I discovered I was blocked on Twitter by Lisa Bari. I have no idea why.
Oh, Lisa.
I must have done something bad.
I might have to DM her here. I don't know if I'm blocked too, but.
Well, if you saw her tweet, you didn't.
Let's do some investigative journalism on that and find out what you did to Lisa that got you blocked.
What did I do wrong this time?
I'm going to start a list of the people who blocked you on Twitter because it's getting longer and longer, my friend. I'm going to block you next.
wouldn't surprise me.
Well, if you want to go back into your Twitter feed, friends, and find out exactly Mr. Holt's Twitter handle so that you too can block him and get on my new list that I'm curating here. He is at Boltyboy, and I am at Jess Damasa. Don't block.
Don't block Jess. Don't block Jess. Don't unsilence Jess.
I usually have nothing optimistic things to say. I am letter P for positive. Your letter P for poopy. All right, enough with this. Enough. All right. Thanks, everybody. Follow along with us on the healthcareblog.com. Be sure to sign up for our email newsletter there. We've got a whole bunch of great content. This week, the THCB gang is going to be hosted by our editor-in-chief, Zoya Khan, because Mr. Holt is in Tahoe, in case you couldn't tell by that creepy background behind him. And yeah, we'll be back at it. Sign up for the newsletter and find out more. All right, guys, we'll talk to you soon. I'm Jess Damasa. That's Matthew Holt. Thanks for joining us.